Thank you so much, everyone, for joining. We're going to go ahead and get started. Welcome to the PSYCKES training for hospital leadership. This is brought to you by the Office of Population Health and Evaluation, as well as the Office of Hospital Care and Community Transitions. So a couple things to note before we jump into the training is all phone lines have been muted to prevent unnecessary background noise, but we encourage users to write in accessing the Q&A box within the WebEx menu. That's either going to be located to the right of your screen, or if you expand it to full screen, you'll just need to hover your cursor over the top center of the screen and select from the menu option for more to access the Q&A box. So we're asking folks to submit to all panelists, and we're asking also not to use the chat function because we're going to be monitoring the Q&A box, and we're going to save time at the end of today's training to make sure that we can address questions, but any questions that we're unable to address during today's training, we'll make sure to follow up with this group. And today's training is going to be recorded, as you heard earlier, and the recording, the slides, as well as additional resource materials for hospitals will be provided shortly after the presentation. So here's a view of our agenda. We're going to talk a little bit about why PSYCKES, why now, and then provide a bit of an overview for PSYCKES, and then go through the details for access protocols. So how PSYCKES can be obtained for your hospital and how to designate those security managers who will be responsible for providing access to hospital staff. And then we're going to spend the bulk of our time talking about successful criteria as well as methods to implement PSYCKES in hospital emergency departments as well as inpatient settings. And then we're going to save a little bit of time, like we mentioned before, for questions and identify some of the training and technical support. And then there's going to be an appendix for individuals that we won't have time potentially to review today, but we want to provide these resources for folks to reference after today's training. So for the why now slide, I just wanted to invite Dr. Flavio Casoy to help walk us through a little bit about some of these new regulations and how that impacts hospitals. So Flavio, would you mind guiding us through this first slide?
Sure, happy to. Thank you, Kristen. Thank you, everyone, for being here. It's an exciting opportunity. The main reason that we really want to sort of do this training and engage with emergency departments is that there are relatively new, maybe not so new anymore, Department of Health regulations related to individuals who come to emergency departments with behavioral health concerns. These went into effect January of 2025, so they've been out there for more than a year. And one thing that's required in these regulations is that there's a requirement to determine if individuals who present with behavioral health concerns have what we call complex needs. And complex needs are defined in the regulation. And one way that emergency departments can determine if individuals have these complex needs is to go on PSYCKES and look to see if there's a complex need flag in the clinical profile of the individual. And then additionally, for emergency departments in hospitals with psychiatric inpatient units, that is what we call Section 939 hospitals, who are discharging individuals with complex needs, there's the requirement to coordinate discharge planning, with care managers if the individual is enrolled in care management, to schedule an aftercare appointment within 7 calendar days following discharge, to send a discharge summary to the aftercare provider, for what happened in the emergency department, lab results, what were the interventions, assessments, and so forth. So we really want to sort of convey, what is PSYCKES, how to access PSYCKES, how to help your staff manage PSYCKES. So giving it back to you, Kristen.
Thank you so much, Flavio. So that covers a bit about what we were talking about. What Flavio, you were talking about here is how psyches can help with some of those new regulations when it comes to reviewing those records, identifying those individuals with complex needs, et cetera. And I do want to share that out of the entire state, close to 80% of hospitals already have PSYCKES access. And below you'll see a count of how many specific users that we have across the state, who are either in the emergency department setting or within the psychiatric inpatient setting. So a lot of hospitals already have a head start on their PSYCKES access. So I'm going to spend a little time talking about this overview of what PSYCKES actually is. So PSYCKES is a secure web-based application that integrates multiple data sources. And it does this to support population health, quality improvement, care coordination, and clinical decision making, and in putting that information into a user-friendly format. So the data sources that we'll have access to in the application, our largest data source, our largest bucket, are the Medicaid claims. So Medicaid data is going to be able to tell us what has been paid for, but not the associated clinical documentation. So you'll be able to see somebody's hospitalization information included on what would be included on the claim, which would be the date, the provider, the diagnoses, any procedures, but wouldn't include that additional clinical documentation. We also have access to other databases. So we have these database access, unlike the Medicaid claims, which comes with potential lags from the time that the service has been delivered to the time that it was billed and then ending up with DOH. But the other data sources that we have access to, those are considered more real time because we're able to update that information anywhere between 0 and 7 days. And that includes information that we're getting directly from the state PC electronic medical record. We're also getting information that's New York City specific, and that includes information from Rikers as well as the Department of Homeless Services. We're also including information that we're getting from DOHMH Maven database, which would include things like IMT, AOT under investigation, and mobile crisis. We also have other OMH statewide databases. So we have information related to AOT, which is that involuntary outpatient commitment. We have information related to suicide incidents that is in the incident management system called NIMERS. We also have information in the CARES database that helps identify services from high intensity outpatient and residential mental health services. Additionally, there is the ability for providers and patients to upload information directly into the PSYCKES application, such as psychiatric advance directives, safety plans, and then there's also the ability to provide screenings, including depression and suicide screenings. So currently in the application, we have over 12 million patients available, and those individuals will have had a history of Medicaid-funded behavioral health diagnosis or treatment, have been part of the state psychiatric center inpatient or outpatient services, or have been enrolled or outreached at health homes. So here are some example reports that are available in PSYCKES that can assist with some of these new regulations. So the clinical summary is a report on an individual patient, and that's going to include things like if they have a complex needs flag, and if so, what was the criteria that they met. It'll also provide care management and outpatient providers. So if you're trying to do, community outreach or engagement, that would be able to identify which of the providers this client is seeing and who I can engage with to help with services, as well as view or upload discharge summary or other care plan documents. We also have reports like quality indicator and statewide reports. And that's a way to be able to review performance on specific quality flags. So if you're trying to see how your hospital is doing when it comes to 7-day follow-up post-emergency or inpatient discharge, that's something that you would be able to use the MyQI and statewide reports for. And then we have recipient search, which allows ad hoc reports to either identify one specific client or identify a cohort or a group of patients that you might have an interest in, such as how many patients that were served in my ED also have complex needs. That's an example recipient search that can be done within the application. So here you're seeing the brief clinical summary. So a few years ago, OMH conducted a quality improvement project called High Risk Quality Collaborative. And part of that work included site visits with CPEPs and EDs to gather information on how users were currently accessing the clinical summary, whether it was a printout or if they're actually logging into PSYCKES, and then what users found useful and valuable in regards to the clinical summary. So using that feedback from those visits, we were able to create this brief clinical summary that helps provide the most critical information in the most easily identifiable way possible, and helped optimize time when reviewing the clinical summary to get the full clinical picture versus looking through, potential pages of the full clinical summary, because it looks back on the past 5 years of Medicaid services, for example, and then having it fit on one or two pieces of paper if it was printed out. All right, so let's talk through the PSYCKES Access Protocol. So this is a bit of an overview of what these steps are. So you'll see here that 100% of New York State hospitals are eligible for PSYCKES access. And in order to get that access, you need to complete required PSYCKES documentations. And as I mentioned before, we have about 80% of hospitals who have already completed this part of the step. And then we need to also have these hospitals sign what's known as the Confidentiality and Non-Disclosure Agreement to register your hospital to use the security management system, which is a system that's for all OMH applications, not merely PSYCKES. And then and that's why you see a difference between 80% have completed the PSYCKES documents, but 82% already have signed the CNDA, because your hospital may be using another OMH application like MHPD or NIMERS. So that might be the discrepancy that you see there in the percentages. And then designating and registering security managers. These are going to be the individuals who are responsible at your hospital for granting and revoking PSYCKES access. And then the last step is going to be enrolling those PSYCKES users. So we already have quite a number of hospitals who have PSYCKES access, and of those, 74% of the hospitals have PSYCKES, active PSYCKES users, but the implementation might have taken place in a different setting besides ED or in. So this is what this breakdown is kind of showing here. So that's the importance of today's discussion, is talking about how to implement in those service settings. So a lot of information to think through. So one of the things that we created was going to be this table. So I'm going to flash up this table and know that we're going to be sharing this after today's training. So this is going to be the table that you're going to be able to look up your specific hospital, and you can look it up by the name that DOH has the hospital or the name that OMH has it. Sometimes there could be some differences, some slight differences there, and then identify if we had access to the federal tax ID, the county, the address that the hospital is located in. But here, when you're seeing in blue, these are really important columns to help you identify where your hospital is at within the PSYCKES access process. So column I here is going to let you know if your hospital has PSYCKES access. And then the second column that you're seeing here in J, this is going to show you the number of active security managers that you have for your hospital. So if you see no here, that means that you have to be starting the process of doing the PSYCKES access, and we're going to go through that process in a moment. But when you're seeing yes here, the next thing to do is to confirm that you have security managers in place. And then over K through O is going to give an idea of how many active users your hospital has and in what service setting. So over here, you see the number of active security managers. You're able to come into this tab and look up your hospital and identify the names of those security managers, because maybe that needs to change or you need to add additional security managers, but you want to have a sense of who those security managers are already at your site. So as I mentioned, that's basically what this slide is going through here, is using that table to identify if you have PSYCKES access for your hospital, if you have security managers, or if you need to add additional security managers, and then do you have staff already in your ED or inpatient who have access to PSYCKES? So After reviewing that tab, as well as today's training, if you have additional questions, you can contact the Psyches Help Desk, which is listed here, or the Office of Hospital and Care and Community Transitions, which could be contacted here. All right, so let's go into more detail about each of these steps. So as I mentioned before, all New York State licensed hospitals are eligible for Psyches access, so step 1 is done for everybody. So step 2 is sending those Psyches documentation, those required documents. So the first document is the Psyches Access Online Contact Form. So this is available and submitted online using SurveyMonkey. So there is where you're going to indicate your organization type, your address, contact information, including CEO or executive director, and then 2 Psyches contact points. These are going to be the people that are going to make sure that the Psyches access protocol is complete from start to finish. And then we also need federal tax ID and Medicaid provider ID. And the reason we need that information is that's how we create your view in the Psyches application. So you fill out this survey, it should take just a few minutes, and then completing the Psyches confidentiality agreement, which again is also available online. And this can be submitted after signed by your CEO or executive director or another person who's legally authorized to bind your hospital to the contractual terms of the confidentiality agreement. And that can be emailed and sent back to the Psyches help desk where we would countersign. So that's step 2. So step 1, am I eligible? Yes. Step 2, have I submitted the Psyches documents? Yes. So step 3 is e-signing that confidentiality and non-disclosure agreement. So all providers are required to sign the CNDA in order to access any of the OMH secure applications, and that includes Psyches, but it's not limited to Psyches. So you'll want to use that table that you'll be provided, and I showcased very quickly before, to see if your hospital's already signed the CNDA, and that's using column Q in that access table. So you can look up your hospitals and see, has my hospital already signed the CNDA agreement? If yes, your hospital can move on to step 4 if you don't already have access. If no, you'll just need to make sure that you're completing that step. So the CEO would receive its 2 emails after completing step 2 that we were just discussing. After we signed the confidentiality agreement and you completed your SurveyMonkey, we on the Psyches Help Desk will reach out to our ITS counterparts to make sure that you're getting emailed the CNDA steps so that you and your hospital can follow these instructions. So you would receive 2 emails with your CEO and you'd want your CEO or your executive director's administrative assistant helping with the location of those. So the email gets sent to the CEO or ED that has been identified on that Psyches contact form. The email would come from this email address, and both emails are typically sent together, and it's usually within 1 or 2 weeks from you submitting all of the materials from step 2. And the email subject line is going to read something like important message from OMH. And the first email is going to include the instructions for logging into the CNDA portal to provide your CNDA electronic signature. And the second email is going to contain the password. The password is what's going to have to be used in conjunction with your user ID to access the CNDA. So after review, the CEO or executive director e-signs the CNDA by checking the box and agreeing to the CNDA terms. But if there's any part of this process where you're unable to find the CNDA email, you can always reach out to the Psyches Help Desk. I will also share that OMH is in the process right now of trying to better streamline this process. As you can see, it relying upon an email to a single CEO could be a little bit difficult for tracking. So that might be getting an update in the next few months, but for right now, this would be the process that hospitals would follow in order to get their access. All right, so after the CNDA has been signed, They will then want to designate security managers because they're the ones responsible for providing access to hospital staff. Providers are going to be the ones that identify who at my organization should have PSYCKES access, and that's going to be determined by the security managers. So they're responsible for requesting tokens, granting and revoking access to OMH applications. So we recommend that security managers are the same staff responsible for managing access to your EMR or other secure clinical applications and having protocols for approving and onboarding and offboarding staff. We also consider having a minimum of at least 2 security managers per campus helps with staff turnover or vacations, so you're not getting a bottleneck of people not being able to get PSYCKES access because you have a security manager who's out on probably a well-deserved 2-week vacation, for example. So again, you have the opportunity to use that access table that we reviewed a few slides ago to identify if you already have security managers and who those contacts are. And if you don't have any security managers or if you need to make changes, we would just make sure that we're completing step 4 as outlined on the slides here. So how does security, sorry, let me repeat that. How do security managers get granted this access? So a security management system self-registration email, known as the SMSSR email, is sent to the CEO or executive director after they have electronically signed the CNDA. So you'll want to work with the CEO, executive director's administrative assistant to locate that email and save it to a place that they can reference again. So this is again typically sent within 24 to 48 hours after someone signs the CNDA. And the email would be sent to the CEO or ED identified on those materials. And again, the subject line is going to be important message from OMH. And the email content is going to include instructions on how the security manager self-registers, your hospital's agency control ID, as well as a self-registration link. What's key here is that because the CEO or executive director is the one that receives the SMSSR email, it's up to that CEO or executive director to forward that email to the appropriate security manager staff. So this would be a process that you'd want to set up for your hospital if you don't already have one in place, is having that SMSSR email in a handy place that you can easily find even months later. So you have the ability to just forward that email to the appropriate staff who would be a security manager. But again, if you're unable to locate that SMSSR email for any reason, you can always reach out to the PSYCKES help desk and we will work with you to get a new SMSSR email sent out. So once the security manager receives the SMSSR email, they'd follow the instructions within the email to self-register. And then they would also activate their token. So after registering in the security management system, the security manager will receive an OMH issued token approval email, and they'll follow those instructions for activating that token. We also encourage the security manager to grant themselves PSYCKES access. So they would do that by using the token to log into SMS and begin creating user accounts and granting PSYCKES access to the applicable hospital staff. And again, we think that they should grant themselves access to PSYCKES so they could help with any technical issues or help monitor use, for example. All right, so this is step 5. So the security manager has registered themselves in SMS, and they've also granted themselves PSYCKES access. So now it's up to the hospital to decide who else at the hospital should have access to PSYCKES, should be logging into the application. So once that list has been identified, that's provided to the security manager. They go into the SMS system and start adding new users, requesting tokens, and granting or revoking access to PSYCKES when necessary. And then the security manager would want to work in conjunction with any of the individuals that they're providing access to and email them to give them a heads up, hey, we've granted your access and security in the SMS system. You should expect an email. The new PSYCKES user will receive an OMH issued token approval email and can follow instructions to install and activate their token. So we have an appendix to this that goes over how to do that. We're also going to be providing one-pagers and other resource materials to the hospitals to reference. All right, so now let's talk about how to implement PSYCKES in the ED and the inpatient setting. So the way to think this through is first we have to plan, we have to identify those staff roles, what are the policies and procedures, and what would the workflow be. We'll also have to prepare. We have to enroll users, we have to orient and train them. We also have to figure out what's the implementation. What is the new workflow that we're going to introduce in order for PSYCKES access to continue and making sure that clinical summaries are being reviewed in the emergency room and inpatient. And then really importantly, how to sustain. You don't want to go through the work of doing an implementation and drop the ball on the 1 yard line of not thinking through the practices for sustaining this use. So how to sustain that? So reviewing usage reports that are available within PSYCKES to monitor people logging into the application and viewing clinical summaries, and then ensuring security managers are aware that PSYCKES access should be revoked if somebody's being offboarded. All right, so let's talk about the planning considerations, specifically the staff roles. So you'll want to identify project leads for the PSYCKES implementation in the ED and inpatient services for each campus. They may wish to create a work group that helps support the planning and implementation. So you have a lead that helps organizing what this implementation is going to look like. Very important, you want to make sure that you have security managers. So if these were originally project managers or service directors, you may want to transition to creating the security managers within the hospital office that already is managing secure access. So again, we identified that potentially a good person to have as a security manager is the same individuals who are responsible for granting access to the EMR or other clinical applications that your hospital might use. Then identifying the emergency room and inpatient users that you want to be accessing PSYCKES. So any staff can be granted access as part of their work duties. So it's really important to decide which staff will be given PSYCKES access and how the security managers will get that information to begin enrolling those users. So some of the recommendations that we have are individuals who are going to be obtaining consent. So maybe the registration desk should be granted PSYCKES access so they can go in and enable the consents when they've been signed. Also, clinicians and individuals who need to know whether the patient has a complex needs flag. Trainees, quick learners, PSYCKES is helpful for assessment and clinical case presentation, so that might be another great use. And then supervisors or other monitoring implementation of use. So people who are going to be confirming that PSYCKES is being used, complex need flags are being checked. It'd be good to make sure that those folks have access as well. You'll want to also identify people who are considered token experts or maybe even super users. These are folks that can help and serve as local supports to staff. So making a couple people super users, making sure that they know the ins and outs of the PSYCKES application, as well as how to activate tokens and the differences between a soft token that's downloaded on a mobile phone versus a hard token if your hospital policies don't allow for cell phones on the floor, for example, then making sure that they're aware of how to activate those hard tokens, which are kind of like a keychain fob looking tool. And then you'll want to identify the trainer. So train the trainer is a great method that's been used in the past for getting implementations through to the finish line. So having somebody who can train and orient staff to the PSYCKES application, as well as look through exactly what they should be looking for in PSYCKES when it comes to the complex needs flag, identifying care coordination, or identifying other outpatient providers. So how to use the application for the needs that your hospital has. And then lastly, always making sure you're monitoring the staff logins and use of PSYCKES. So keeping that track using those PSYCKES usage reports. Okay, so the next thing to think through now that we've identified the roles is thinking through policies, procedures, etc. So, who will patients call if concerned about their health data or if they want to withdraw their consent? So, often hospitals have a patient relations office. So, you'll want to go into Psyches and make sure that the consent form that's pre-populated with your hospital name that you can update to include hospital contact information for people when they want to withdraw consent, they should contact the patient relations office in providing those details. And then consent forms. Do you want to use paper or do you want to have e-signing? So paper is easy to start with, embedding that in the intake paperwork, but we also have a mobile app for both Android and iOS devices. So if you have an iPad or a tablet that you use for intake workflows, you can sign into Psyches. There's an app that you can use, and e-signing is one of the features of that app. You also have the option to build in this form, this consent form, into your EMR and have the e-signing capacity in there. And that might be the best for long term as it prepares hospital for other interoperable solutions in the future. Another thing that your hospital is going to want to do is make sure that you have a definition for clinical emergency. So no consent is required in the case of clinical emergencies, and oftentimes people showing up to the emergency room, that's a lot to do with a clinical emergency. So making sure that you've clarified the definition for staff, which may be different for medical clinical emergencies than they are for behavioral health, and then clarify staff documentation requirements. You'll also want to consider any EMR changes that might help support the work. So a checkbox to identify if a consent is in place. So having something in your EMR when you're looking up this client's record and seeing Psyche's consent has already been enabled in Psyche's. Great, one less step for me to do so you don't have to reconsent somebody. Building in the consent to the EMR, like I've mentioned, and also using a checklist or prompts in the EMR to support documentation of clinical emergencies. And mobile devices, as I mentioned, soft tokens are available to be installed on mobile devices. So do you have to think through any policy changes? Like I mentioned before, there might be some policies where cell phones are not allowed on the floor, but if you want to have more people being able to access Psyches, if there's any policy change there when you want to have them having the RSA token available on a mobile device versus keeping track of all of these hard tokens. All right, so here is one example of a recommended workflow when it comes to consent all or consenting. So there is a workflow here where you can consent all emergency presentations. So the Psyches consent could be embedded in the routine consenting process for all ED presentations during that intake or direct admission. The administrative or registration staff as a protocol, consent all of the patients, they enter the consent into Psyches, they access the clinical summary and print out for a paper chart or download and save it to the EMR, and then alert the clinical team once this has been completed. The clinical team conducts the patient assessment evaluation on complex needs using the data from the Psyches clinical summary. So the advantages of this is that it's embedded already into a routine consent workflow and it doesn't require any clinician time. The disadvantage is registration staff would log into Psyches for all clients, but it might be somebody who doesn't exist in Psyches if they're not Medicaid enrolled behavioral health client. It might not yield results. An alternate workflow could be patient is triaged and registered, clinical staff conducts screening to identify the patient with chief behavioral health related complaint, and the clinical team is responsible for consenting the patient or determining a clinical emergency, attesting to access to Psyches, responsible for getting the clinical summary into the EMR record and reviewing the clinical summary. So the advantage here is that you have a greater chance that the Psyches clinical summary would be available for the patient because you're doing that screening for the behavioral health related complaint. But a disadvantage could be the clinical staff time is used for administrative tasks. So I think that's why the first is our recommendation is just to consent everybody. But again, completely up to each hospital. All right. So we've talked through the planning stage. Let's talk about preparing. So we need to enroll staff users. So you want to make sure the security managers have that list of staff to enroll, including their name, email address, and staff title. It's really important to make sure the email address is entered in the security manager system correctly, because that's how that triggers that email for token. So you want to make sure that that out of everything is the thing that we're spelling correctly. And then you want to make sure that you're orienting and training staff to use psyches within the different service settings. So you want to help identify individuals with a behavioral health crisis at risk for poor outcomes and who might be eligible for enhanced services. So how to use psyches to identify those patients with complex needs, how to install your token, whether you're using a mobile device or you have to activate a hard token, logging into Psyches, and then who should they contact if they need technical support. And then what the Psyches related workflow is for their role. There should be potentially role specific training that could be helpful. And then what the definition for breaking the glass is. So for those clinical emergencies, what is that definition and how do we document that in our EMR? So you always want to underscore any of the security concerns. You will only use your hospital's token when you're working at your hospital. So if you have people who are working at multiple different hospitals, they work at 3 distinct hospitals, that would mean that they would need 3 distinct tokens. You wouldn't want to use your hospital A token while you're meeting with patients at hospital B. So there needs to be distinct tokens, because when you're enabling access to client information, you're enabling it for the entire hospital. So you want to be very, very careful about exactly what token that you're going to be using, especially if you're working at multiple hospitals. And then also one user, one token. There's not a shared token protocol where we have one token that everybody uses to log into the Psyches application and enable access, for example. All right, let's talk through how to implement and sustain. So staff begin using Psyches in accordance to the plan that's been established by your hospital. You want to have those token experts and super users available to assist staff, and then identifying those implementation leaders and work group teams to monitor operations, to identify any challenges or barriers, to adapt and modify implementation plan as procedures as needed, and then as always, contact our Psyches help desk if there's any question that the team is unable to answer. And then just to sustain the practice, making sure that you're reviewing the usage reports. So which staff are using Psyches? How many clinical summaries have been reviewed in this certain time frame? You have the ability to do and run these reports within the Psyches application, and our appendix goes over specifically how to run those reports. So how to ensure security managers are deactivating tokens for departing and offboarding of staff, providing Psyches access and training to new staff as part of onboarding processes, and then consider modifying and expanding the use of Psyches when appropriate. All right, so here are a few things that we want to make sure that everybody is aware that they're going to be receiving after today's training. So the hospital resource packet is going to be something that is designed with hospitals in mind. So the action planning form and other resources used in prior ED Psyches implementations, this is like a checklist that your implementation work group can review to see, have we done this step, have we done this step, and checking that off so you know exactly where in the process that you are. We also have one-pagers that are available specifically for the security managers. So they have the ability to see, like, this is how I grant Psyches access in SMS, and here's how I revoke access in SMS. We also have a Psyches consent script. So if you want to have an FAQ for frequently asked questions when it comes to introducing the Psyches consent, where a client might have questions about it, we have an FAQ script that can help with providing the language that you can use to talk about what Psyches is, as well as some responses to some frequently asked questions. And then we also have a Psyche summary checklist workflow of making sure how you're using the summary, how to activate tokens and log into Psyches depending on your token, and then lastly, how to upload psychiatric advance directives into the Psyches application. So these resources were created with hospitals in mind. We also have the PSYCKES implementation resources, which aren't hospital specific, but would be for any type of organization to do implementation. So that's another place that you can go for additional resources. Just note that it's not going to be hospital specific. We also have additional training resources that we're going to have available online. So as you are well aware, we have these 2 trainings for hospital leadership for PSYCKES, and then we're going to have 2 additional trainings for the ED staff. So the direct, like the clinicians who might be the ones logging into PSYCKES and looking at the complex needs and other materials in the application. So we have training resources for them on how to do certain things. So quick videos, no more than 5 minutes, on how to log into PSYCKES, how to look up a client and enter consent, how to review clients' clinical summary details, etc. We also have user guides for each of the individual modules or application features. So if you want to learn more about recipient search or clinical summary, there's a user guide that you can reference, as well as how to use the PSYCKES mobile applications. We also, on a quarterly basis, provide opportunities for live trainings like you are here with us today. So we have these opportunities for live training opportunities, and then we take those trainings and we upload those recordings to our training website. So you have the option to either register for a live training, or you could listen to a training that might have already occurred, but you didn't have the opportunity to join that training. You have the opportunity to listen to those recordings, as well as review those slides at a time that's convenient for you. And then you'll notice, if it not today, maybe tomorrow, we're going to have an update for the What's New section. So every time we have a new release of new features in the PSYCKES application, we're going to have an update of the What's New section of the PSYCKES website. So not only do we email all of our active users as well as the security managers every quarter when we have a new release with our release notes of what are the specific updates that we've made to the application, we'll also have this What's New section right on the homepage of PSYCKES that gives people a sense of like, oh, this is new since the last time I checked the application. And then for a lot of the training and technical supports, we do encourage you, again, the website is a wealth of information, but we're going to be making sure that all of the hospitals are getting provided the resources that I just mentioned before. But we'll always have additional resources at our website. And then again, any questions that you have regarding the PSYCKES application, whether it's data or functionality or assistance with some of the login requests, we can help. We're available from 9 a.m. to 5 p.m. Monday through Friday by emailing the PSYCKES help desk at this email address here. I do want to share that because, as I mentioned, SMS is used for all OMH applications, all OMH secure applications, not merely PSYCKES. We unfortunately don't have control over token issues, like if there's an authentication error message. However, we're a really great partner when it comes to following up with our ITS colleagues who can help with that assistance of tokens. So again, feel free to reach out to our PSYCKES help desk. And I know that I've actually spoken to some of you who are actually on the call today from the PSYCKES help desk of recent, since a lot of people have been writing in. So if you have any questions or concerns, we typically give a response within 1 business day of receiving. And sometimes if it's more complicated of a question, we might even be, requesting a time to jump on a call together so we can review together. So the rest of my material would go into a little bit of what we're including for the appendix, but I want to stop here for a moment because I'm sure that we've gotten some questions in. So I want to turn it to Michelle to see if there's any questions that have come in that we could maybe answer live on air. I know that you and Ashma have probably been doing a great job of already answering them within the chat itself.
Hey, Kristen. Yes, we did have about 3 questions come in so far, and a couple of them you've answered in your slides, but it might be helpful just to reiterate for everyone else. The first question is, if I work at multiple hospitals, will I need to get a separate login and token for each?
Yeah, so that I'm sure that question is what came in prior to we going over that part of the presentation. But yes, because as I mentioned, access as well as consenting and connecting and attaching clients to specific views happens at the hospital level. So as I mentioned before, if I'm working at hospital A, but I then go to hospital B for my next shift, I want to make sure that I have two separate tokens for each of those different use cases, because when a client consents to the PSYCKES consent, it's listed at the organization level. So it'll say hospital A, that's who they're consenting to release their data to. So if you're at hospital A, you want to only have that access for patients that you're seeing under hospital A.
Great. Thank you, Kristen. The next question is, are residents who are training in hospitals eligible for PSYCKES access? And if so, would they go through the same process to get access through the security manager?
That's a great question. And the answer is yes, especially if they're going to be, residents in the hospitals who are working with clients, and that might be part of their role is to look up information and identify things. So the hospital themselves would identify which staff should have access. So if you think that the resident is going to be necessary for part of that workflow, then you absolutely can grant them access. And that would be done the exact same way as anybody else's access, going through the security manager. I will emphasize that you'll also want to make sure, like when the resident is done and no longer working at the hospital, maybe has moved on to another hospital, that you guys have policies in place for making sure that you're revoking access. Because again, especially when you're thinking about mobile or hard tokens, if somebody has a hard token or a mobile token on their phone and has been granted access, and they leave the hospital, they are no longer there, they still have access potentially to that hard token and that soft token. And as long as they have internet access, they could log in and access that information. So it's really, really critical that the security manager that has protocols in place, just like you would for getting somebody out of their electronic medical record, making sure that that access is being revoked when appropriate.
Thank you. And we've also gotten a few questions in asking if the slides and recordings will be sent to all attendees. So I want to just answer that here and say, yes, we will provide all of the slides, recordings, and materials after the webinar is over to everybody. And then the next question that came in was, are VA hospitals eligible for PSYCKES access?
Oh, that's a good question. Are they licensed by DOH? And I wasn't sure, I don't know if Flavio or my other OCT colleagues would know that off the top of their head, but right now the way that the eligibility works is that all DOH licensed New York State hospitals are eligible for PSYCKES access. But I can always take that back if we're not 100% sure if VA hospitals are licensed by DOH, but we could definitely take that back to look into.
Of course, then I think the other part of that question is if someone sort of receives all their services through the VA because they have VA benefits and are service connected, and not through Medicaid, how much information would be available in the PSYCKES application for that person?
That's a great question. So as a lot of the information that we have from PSYCKES is coming from Medicaid claims, but if this person, let's say, for example, had some sort of, maybe they were in a New York City homeless shelter at some point, if this person has, even if they're not Medicaid enrolled currently, they could have been enrolled in the past, and we could show that information. We also have information for people if they are part of the state PC. So if somebody has been a part of the state PC, they will show up in the PSYCKES application regardless of their Medicaid status. So it really, I don't have a specific response other than it depends. And the best way that you can do is following that recommended workflow of just getting consents for everybody and then looking up the individual to see if they do exist in the application.
All
Any
right, thank
other
you so much.
questions?
No, I think for now, oh, I'm sorry. Actually, there was just one more question regarding guidance on what a clinical emergency is, and that's something that we can provide in the chat and also in the materials we'll send out as well. But I just wanted to bring that up here as well.
You know what? That's actually
Right.
a good, and we have a little bit of time. So what I could
Mhm.
do is like this is part of the appendix. So I'm just jumping a little bit ahead of like some of the information that we have in the appendix, which includes like tips for security managers, how to, complete the consent form, how to do some audits, but talking about breaking the glass in a clinical emergency. So we have some information here of like what are some criteria and protocols for those. So the criteria for breaking the glass could be things like suicidal ideation, homicidal ideation, severe psychosis, overdose or other safety issues, and if someone is sedated and non-responsive potentially. So the clinical emergency is defined as a medical or behavioral condition for which there is an immediate need for treatments and symptoms are sufficient severity that the absence of immediate treatment would result in serious harm to self or others. So what you want to do is just make sure that your hospital is fully aware of what these definitions are, and then providers should be responsible for ensuring that the medical record supports emergency access by documenting why and how the client meets that criteria for clinical emergency and attesting with their signature, date, and timestamp. So you don't have to do that within the PSYCKES application. Within the application, when you're looking up the individual, you have the option to select clinical emergency, and then you'll have access to that person's clinical information for 72 hours from the time that you enable that access. But what you'll want to do in your EMR is document the why and the how in case ever in the future, if the client asks later, like, why did you look at my information? You would have that to rely upon saying that this was a clinical emergency and this is how you met that criteria.
Kristen, this is a different topic, and I'm sure we're going to have a different webinar, but um, very soon notification will go out that there have been updates to the mental hygiene Article 9 forms for transport to the hospitals and then for inpatient emergency admissions. And one of the changes is sort of the inclusion of checkboxes, that it would be it would be easier for the hospital to know that if someone is transported to the hospital involuntarily on an emergency basis, why, what was the concern in the community? If the person who brings them or the entity that brings them fills out the form correctly, they'll be able to check, sort of risk for danger to self, risk for danger to others, and or sort of significant inability to care for themselves because of their mental illness, and that could be the basis to determine whether or not there's an emergency.
Absolutely. Thank you so much for sharing that, Flavio. And I can add that to the slide too, if we think that those forms, like, if they're ready or soon to be ready for the hospitals, I can use that. And that could also be used for helping document the reason for enabling that access. So I think that's a great tip. Thank you so much for sharing.
And we did get one other question in, Kristen. It's related to New York City Health and Hospitals, or New York City H&H has 11 hospitals. Do individuals that work across the system need 11 tokens?
Oh, that's such a great question. Okay, so there's a couple different things for health and hospitals, is that there are individuals who work in their oversight capacity at health and hospitals, and they work at that network level. So certain staff have access to a health and hospitals network view, which is basically being able to see the information for all of the health and hospitals within a single view. So that's a dedicated view, and health and hospitals decides which of their staff have access to that. But if you're saying you're a clinician who works within a patient, a patient forward manner where you're meeting with patients and you're working at all 11 different health and hospitals, at the way that health and hospitals had asked us to set up their view was to have each hospital as their standalone view. So in that case, I don't know if we might want to take that offline to follow up with this particular use case. But in that case, again, if you're working at 11 different hospitals, you can't share tokens between hospitals. So you'd have to have a distinct token for each of the dedicated hospitals that you're working with, because again, PSYCKES and access is granted at that hospital level.
Great. Thank you, Kristen. I think that answered this person's question because they were referring to patient point of care. Um,
Mhm.
so I will make sure to take down their name and email as well for additional follow-up too. And I think that's all of the questions that came in.
That's great. Well, I love the idea of giving people back some time in their day. I know that everybody's very busy, and especially learning a new system can be challenging, but I just wanted to share that the Office of Population Health and Evaluation, as well as our OCT colleagues, are here to assist you in this process. So what I will do is make sure that within the next day, folks who have attended this training will receive the recording as well as the slides, as well as the hospital materials that we touched base on today. So you can get started with some of your access questions or concerns, and then giving you an opportunity to look through a little bit more of those appendix, which I shared has a couple different tips and tricks. But we will be hosting another one of these trainings. I believe it's next week as well. So if you had, folks who weren't able to join us today, but we're sad that they couldn't join us, they can join us for that next training. And again, we will eventually be placing these recordings onto our website. So again, if a month goes by and you want, new folks to be able to access this material, we'll also have it available on our website versus just those who attended the training themselves. But I want to thank everybody again for their time, for taking the time for this conversation today, as well as our OCT colleagues who assisted in today's training, and really looking forward to getting to know lots of the hospitals a little bit better through this process. So thanks again.